Okay, so we just got our first question on the website, and it's from Lourdes. Lourdes asks, my daughter is a healthy 10-year-old kid, but after finding out that her friend's oldest sister has scoliosis, she's afraid that she's going to get it too. I thought scoliosis was something that only older people get. Is that not the case? And does something like this affect the whole back? Lourdes, thank you for that question. So people of any age can develop scoliosis, a type of scoliosis, and the majority of those afflicted with scoliosis find that it's during adolescence, as they enter their teenage years. Now, scoliosis can develop in infancy or early childhood, and the primary age of onset of scoliosis is 10 to 15 years old. So with approximately 3 million new cases that are diagnosed every year, about 3% of kids in the US develop scoliosis. According to American Academy of Orthopedic Surgeons, a governing body for my specialty for orthopedic spine surgeons as well, idiopathic scoliosis occurs 10 times more common in girls than in boys, especially over 10, and we really don't understand why that's the case. So a human spine consists of 5 sections. There is the coccyx, the sacrum, lumbar, thoracic, and cervical spine. The 2 regions that are primarily affected here, you can see on the video, the sacrum, the lumbar spine is the lower back, and then we ascend to the thoracic spine that's held pretty stable by the ribs, and finally your neck, the cervical spine. But the 2 regions that are most commonly affected by scoliosis is the thoracic spine, or mid-back, and the lumbar spine. Despite the fact that the thoracic spine is stabilized by the rib cage, it's still common to see both structural and the compensatory curve in that region, especially in teenagers. Now, the lumbar spine, which involves essentially most of our weight-bearing energy and has the tallest, most dynamic discs, lumbar spine develops scoliosis more often later in life as those very discs lose height and result in a deformation of the human body. There are some differences according to age as well. Adolescents, most cases in the thoracic spine. Adults, seniors, mostly lumbar spine or lower back. So it's not atypical for someone with adult onset scoliosis to complain of significant lower back pain. There are some signs and symptoms for parents to keep an eye out: uneven shoulder blades, uneven shoulder height, uneven hip height or position. You can find that when your kiddo bends forward, you'll see some asymmetry with regards to their rib cage, and we're going to talk about that a little more in a minute. And you can actually find that the entire body kind of leans to the side. And again, that's more with the elderly, where they don't have such flexibility to compensate for a structural curve. And finally, where your head is no longer centered on top of the pelvis, that's where I find elder patients will have a lot of pain.